wondering what a treatment would look like for plantar fasciitis? Dr. Madeline here at Forward Spine Center, and today I'm going to show you what a treatment may look like if you present to our office with plantar fasciitis or foot pain. Remember, each treatment is individualized to you. A lot of times when we do address a foot or extremity issue, it's really important that we address the whole system. So starting by addressing the pelvis, how are your hips moving? How are your knees moving? And then how is that foot, that ankle, how are your tarsals, your toes moving as well? We complement care by adjustments, doing some therapies, if it be acupuncture, some tool-assisted techniques. And then we also, what's really important is also incorporating that strengthening component as well. I do have a video also about just to go over some of the strengthening and why that isn't so important. But if you have any questions, reach out. Stay tuned. Dr. Madeline here at Forward Spine Center, and today I'm going to demonstrate what a procedure would look like here at Forward Spine Center if someone would present with plantar fasciitis or foot or calf pain. So when I treat a patient, I'm going to start out by adjusting the pelvis. I can do this either in side posture or using drop, or we may use a little activator. So here I'm going to adjust the patient's left pelvis. And when we adjust, if I'm treating the foot, it's very important that we treat the whole system. So then I'm going to make my way down into the knee, into the hip, make sure the hip is moving, make sure the patient's activating the glutes, the posterior chain. How is this joint moving? How is the knee joint moving? How is the foot moving? I may adjust the calcaneus or the heel. And then I'm going to make my way into the calf or the gastroc. When you're dealing with plantar fasciitis, a lot of times they may be having some adhesions or tightness in the calf. So really breaking up the calf, making sure you have full range of motion in this muscle. I'll either use my hands, I may use a tool to help break out any adhesions that I may find. And then I'll have the patient flip on over onto their back. I'll adjust the hip, and then I'll get into the toes, making sure the patient has full dorsiflexion of specifically that first big toe. We want so much dorsiflexion, so much movement of this first toe, even to walk. But if the patient is running or jumping, we need even more movement in that first toe. Movement in all the toes, so I'll just make sure that everything's moving in this joint. And then to complement care, depending on how the patient's responding, I may incorporate acupuncture as well. So then I'll have the patient flip on over again onto their stomach. With acupuncture, we first sanitize the area. And I warn the patient it may feel like a little mosquito bite. Making my way into the gastroc, the calf. When I put someone on acupuncture, they may stay on needles for anywhere from 12 to 20 minutes, depending on what we're treating and the patient. The patient will stay on for 12 to 20 minutes, and then we'll come out and we'll take out the needles. And a lot of times patients usually will respond well to just one treatment, but we usually put them on a course of treatment plans anywhere from 1 to 2 times a week for a few weeks with frequent progress exams, just to make sure that they're showing the progress that they need to see. Dr. Madeline here at Forward Spine Center. If you have any questions, please feel free to reach out. Thank you for allowing me to be part of your health journey.